6. Oils and liniments.
We're continuing on with therapeutic modalities, but now we're going to look at the application of various types of medicated oils and liniments. And here with me today to demonstrate the usage of these different types of applications. I have medicated patches, and basically what it is, it's a patch that has been impregnated with various substances that are either analgesic in nature or they're hyperemic, meaning that they increase blood flow to an area. Characteristics that are desirable and kind of blocking pain, but also in stimulating the healing process in a localized area. So we have these patches here. We have another product here. This is kind of an oil-based product. It's called Posaman, and it's an analgesic, but it's also has medicated oils, and it has herbal components to it that help to block pain, stimulate blood flow, and once again promote the healing process. We also have a product called Zengui Shui. This is used in areas where there is inflammation. I believe it was originally designed to treat strains and sprains in joints, such as a sprained ankle. This, however, is an alcohol-based product. It's not oil-based. So, whereas the oil-based product lends itself really well to massage technique, either Eastern or Western approaches to massage. The Zengui Shui, being alcohol-based, does not. It's very drying, and if you attempt to massage it into an area, you actually peel off the outer layer of, or exfoliate the outer layer of skin. So we tend to spray this on, and oftentimes this is the last thing that we apply in a treatment sequence or a protocol of therapy with the patient. So what we might do first is do our massage therapy and follow with an application of heat or ice, and then finally spray this on. We like to keep these products because they are analgesics, so they are numbing to the fingertips. We like to keep these in small spray bottles. So I have a little caddy here, and in the caddy, in this little bottle here, I have the Zengui Shui ready to be sprayed on an area. And just as kind of a side note here, that if you, when you're spraying on a patient, it's really a good idea to cover their eyes, just to make sure that none of the mist, none of the vapor from this gets near their eyes. So put a small towel or other covering over their eyes to protect it. I also have the Posaman here in just a very small little spray bottle. This is ready to be sprayed. Any time that you're spraying something, I do highly recommend that the patient's eyes are covered and protected to prevent any of the substance from getting into their eye. I do have another bottle here, and this is not something that I've introduced with these other products, but this is a combination of safflower oil and lavender oil. Now, lavender oil is a very nice sedative. It helps to sedate the nerve endings. It also stimulates blood flow or hyperemia to localized areas. So it's another medicated healing oil. This is something that we have made up by combining the lavender oil and the safflower oil together. The reason that we dilute the lavender is because it can be quite irritating, especially to fair-skinned people. It can cause topical rash reaction in some patients, so we like to dilute this and use it in that way.
The primary goals of medical massage therapy with the use of therapeutic modalities is always the reduction of acute or chronic inflammation, especially edema, and the restoration of normal range of motion. Additional goals include the facilitation of tissue repair and increased strength in muscle, ligaments, and other connective tissues.
Okay, we're here to continue this presentation on therapeutic modalities, and now we're still looking at the use of liniments and medicated oils. We're going to look specifically at the use of the medicated patch. I've opened this package here, and I've taken out one of the medicated patches. And medicated patches are a very nice item to use Once again, they're analgesic, they increase blood flow, so they stimulate healing to the area of involvement. Nicely combined with massage therapy, with manual therapy applications, and frequently they can be the last thing that you do. I like to utilize these with my patients because if a patient has come in with a specific complaint and I've treated that problem and they're leaving the office, I can apply a medicated patch, and the patch will continue to work for hours, supplying pain relief and stimulating blood flow to that area. So I simply take the medicated patch from the package and I just peel it away like so, and you will not be able to use these patches on patients with latex allergies, so keep that in mind. And there are a lot of people, and you're going to want to ask the patient if they have a latex allergy. And the medicated patch is simply placed over the area of involvement like so. It's sticky and it will stay there until the patient showers or simply removes it. And it can be left on all day. It can be left on to the next day, whatever the patient is comfortable with. The other really nice part of these patches is that they are very easy to cut, into a specific size. If you want to place a smaller patch on a very localized area, a hyperesthetic area, an area of localized pain, you can simply cut out a patch, whatever size you want, and then you can place that directly on the area that you want to treat.
In selecting and applying a therapeutic modality, the medical massage therapist must consider the following contraindications and precautions. Is the physiological effect of the modality counterproductive to the treatment of the condition? What is the patient's history? What is the condition that is being treated? What is the physical status of the patient? And how does the patient's age factor into the treatment?
So we continue on with therapeutic modalities, looking at the use of a medicated oil, in this case, Posaman. It's a very nice oil. Again, has analgesic qualities, and it is herbal in nature, so it nourishes the area of injury or the area of involvement. It's oily, so it's easy to use with massage technique. I can demonstrate here, once again, highly recommend placing something over the patient's eyes to prevent inadvertently having spray or a droplet of spray, spray them in the face. I will ask Brett to make sure that her eyes are closed in this case. Then I can simply take this applicator and simply pump a little bit. See how easily it's sprayed. Again, it's very oily. It's easy to rub in and to massage over an area of involvement. Now, if I want to work this as part of the massage treatment, I can very easily do a little bit more aggressive treatment around the lateral epicondyle for tennis elbow, like so, and work that in there. Now, stage 2 of this is going to be to do a procedure that's called gua sha, and this is a scraping technique that actually reddens the tissue, increases the blood flow to the area, once again stimulating the mechanoreceptors and helping to block pain in the area.
The following physical indicators must also be considered: pain sensitivity, pregnancy, pacemakers or metal implants, seizure disorders, skin conditions, reactions to treatment, psychological status, medications, infectious illnesses, cancer, location of target tissue, and handicap.